Assalamu alaikum warahmatullahi wabarakatuh. Welcome back, guys, to the channel of summary of standard medical textbooks like Davidson, Harrison, Pocket Medicine, Oxford Medicine, McMaster Textbook of Medicine, and so on. That is nothing but standard medical textbook, standard medical notes. So our next topic is finger clubbing and hypertrophic osteoarthropathy. So why we are discussing this topic? Because the most common cause of these two are nothing but pulmonary causes. That's why this topic we are discussing here. So let us begin with the name of Allah. Finger clubbing describes painless swelling of the soft tissues of the terminal phalanges, causing increased longitudinal lateral convexity of the nail. Clubbing of the fingers, also you call it as drumstick appearance. Okay. Clubbing of the fingers develops due to proliferation of the connective tissue of the dorsal aspect of distal phalanges of the fingers, or less frequently of the toes. So that leads to the elevation of nail. Okay. And the angle between the nail bed and the nail fold is more than 180 degrees. Normal angle is less than 180 degrees. Obtuse. Normally, the nail fold and nail angle is obtuse, but in cases of clubbing, it becomes more than 180 degree. Okay. What are the mechanism? The underlying mechanism of clubbing is actually not known. However, growth factors such as vascular endothelial growth factor, growth hormone, platelet-derived growth factors seem to play a role along with hypoxia and certain cases, hypoxia, PD, GF, and VEGF. You can see these images. See the clubbing, the drumstick appearance. Drumstick is like this. By which you sound the drum. So this is drum, no, drumstick. So this is the swollen part, and this is the stick, that is drumstick. Okay, so this is the angle becomes obtuse more than 180 degree. Normally it will be like this, 160 degree like this, but it become obtuse. Coming to the causes of clubbing, most common, see, these are according to the frequency of causes. You will move like this. Most common cause is respiratory, then cardiovascular, then gastrointestinal, then hematological, then other. In other, remember endocrine, most common endocrine. Okay. So in respiratory, remember suppurity and malignancy. Suppurative causes means infective causes, and suppurative infective causes, and second is malignant causes. Chronic suppurative lung diseases like empyema, bronchiectasis, cystic fibrosis, lung abscess, tuberculosis also. Then this is also important. What is that? Fibrosis, interstitial lung disease patient will have, that is a very important feature of interstitial lung disease. Okay, clubbing. Then malignant causes include mesothelioma, most common. Okay, these are the most common causes of pulmonary causes. Then coming to cardiovascular causes, cyanotic congenital heart disease. It is not acyanotic, it is cyanotic congenital heart disease. Example, tautology of Fallot or Eisenmenger syndrome. Eisenmenger syndrome. So in these cases you can have clubbing. Subacute bacterial endocarditis, very important. Subacute bacterial endocarditis, infective endocarditis they can have clubbing along with that finger what you call linings. Okay, atrial myxoma, again heart causes. Okay, atrial myxoma. So congenital cyanotic CHD and bacterial endocarditis and atrial myxoma. Gastrointestinal causes include So either liver causes and malabsorption causes, malabsorption causes, malabsorption causes can also have clubbing. So liver cirrhosis patients can have clubbing. Malabsorption causes inflammatory bowel disease, IBD, celiac disease, tropical sprue, hepatocellular carcinoma, again either due to liver or due to malabsorption. Cirrhosis of the liver, these three, this three like this three like this. Okay, IBD, celiac disease, tropical sprue, cirrhosis of the liver, hepatopulmonary syndrome, hepatocellular carcinoma. So respiratory, cardiovascular, gastrointestinal, then hematological causes, Hodgkin's lymphoma, chronic myeloid leukemia, myelofibrosis. Others most common is endocrine, thyrotoxicosis patient. Thyroid can have clubbing, that is called thyroid acropathy. Other causes include secondary hyperthyroidism, secondary hyperparathyroidism. Okay, some cases of pregnancy can also have this clubbing, esophageal cancer. So these are the causes, but in these most common are, remember, endocrine causes, thyroid, and secondary hyperparathyroidism. Okay, idiopathic. So if nothing is there, it can be idiopathic also or hereditary also. Now, hypertrophic osteoarthropathy. We will learn what is that hypertrophic osteoarthropathy next. Just remember these causes. So in clubbing, you remember, clubbing can be unilateral also, it can be bilateral. Usually it will be symmetric, bilateral, and usually most of the time it involves the upper limbs, but in sometimes it can involve the lower toes also, lower limb toes also. Okay, unilateral clubbing you can see when there is hypoxia to one limb. Some due to some reason there is hypoxia only one limb, then you can have like some AV malformation, or like some AV fistula you make for dialysis. In those patients you can see clubbing. Now, hypertrophic osteoarthropathy causes, again, pulmonary causes, bronchogenic carcinoma, suppurative lung disease causes, interstitial pneumonia. So these are the causes. Next, cardiovascular causes, cyanotic CHD, subacute bacterial endocarditis, atrial myxoma. Okay, I mean same causes as clubbing. Okay, because clubbing is a component of hypertrophic osteoarthropathy. It is a component. So the causes here will be causes there. So GI causes include inflammatory bowel disease, celiac sprue, carcinoma of esophagus, carcinoma of liver, carcinoma of bowel. So any abdominal neoplasms can have clubbing. Patient of abdominal neoplasms can have clubbing. So respiratory you remember, CVS you remember, GI you remember. Okay, GI. Then hematopoietic you remember. Hematological cause, hematological, Hodgkin's, chronic myeloid leukemia. Okay, Hodgkin's lymphoma, chronic myeloid leukemia, myelofibrosis, fibrosis of the bone marrow, infected arterial grafts. So remember these are causes of unilateral clubbing, infected arterial grafts. Yeah, AV fistula make and that gets infected. Okay, aneurysm of major extremity artery. These are causes of unilateral clubbing. And AV fistula of major extremity vessel. So these three infected arterial grafts. So some artery graft you put here in one extremity, one limb. So that will cause clubbing. Aneurysm of major extremity artery, like subclavian artery aneurysm of right side. Okay, or AV fistula of the major extremity. Most common you see is this one, AV fistula. Okay, AV malformation, AV fistula or AV malformation. So these are the causes of unilateral clubbing. What are the causes of bilateral where there is involvement of lower extremity, bilateral lower extremity involvement, where you will see in aortic aneurysm, patent ductus artery. What is patent ductus artery? This is the aorta and this is the pulmonary artery. There is connection between these two. Actually, this is normally in neonates, but after delivery, after some days of delivery, this will go off. This will become, this will what do you call, go off, and these two will be different. But in some cases, it will persist. So that is patent ductus arteriosus. So blood will flow from from aorta to pulmonary artery initially, but when it becomes Eisen Mingers, then blood will the deoxygenated blood will flow from pulmonary artery to the aorta. Okay. So patent ductus arteriosus, aortic aneurysm. Okay, these two are the causes of bilateral lower extremity involvement. Okay. Moving forwards. Most common cause is suppuratory or malignant lung disease. Remember that one. Bilateral clubbing is characteristic for central cyanosis. Unilateral clubbing is limited to one limb is a result of impaired arterial perfusion in that affected limb, either due to patent ductus arteriosus, okay, PDA, aorta, aneurysm of aorta, AV fistula, like in patients with CKD, okay. Unilateral clubbing. Remember, when there is not a good supply to one limb, so they can develop unilateral clubbing. Or arthritis, inflammation of the artery. Now, what is hypertrophic? Those were the causes of clubbing and unilateral as well as bilateral. What is hypertrophic osteoarthropathy? It is a triad actually, which consists of digital clubbing, periosteal. So periosteum is the superficial layer of bone. Periosteal new bone formation, subperiosteal new bone formation, that is also known as periostosis, and that subperiosteal new bone formation will be painful. Okay. And third is that because of that pain they'll have arthralgia and joint swelling. Where this occurs at the growing ends. That is nothing but epiphysis of the bones. Epiphysis is a growing end of the bone. Epiphysis, also diaphysis. Diaphysis are shafts of long bones. Okay. So joints will be affected. Okay. So it is a triad of digital clubbing. There is periosteal new bone formation, which you will reveal by X-ray, and arthralgia and joint swelling. See here, there are images of hypertrophic osteoarthropathy. Arrows you can see the arrows, see here, there is more whitish bones you are seeing, no? More whitish bones at the margins of the shafts of the metacarpals. So that is nothing but subperiosteal bone formation. So that's about upper limb, okay? You can also have it in lower limbs, like in aortic aneurysm, no? And one more thing, no? So see here, more whiteness you are seeing in the margins. No, that is nothing but subperiosteal bone. This is femur, this is tibia. See here, tibia, in fibula also. See, so that is hypertrophic osteoarthropathy. So there is painful subperiosteal formation of new bone. Periosteal thickening can be palpable over surfaces of the bones which are not covered by muscles, like around the ankles and around the wrists. So muscles are not covered, no? So, and tenderness in these locations, as well as you can see edema, joint pain, features of joint effusion, most frequently affecting the knees, ankles, elbows. Okay. joint effusion affecting knees, ankles and elbows, large joints, basically large joints, okay, and pain basically in small joints like ankle joint and wrist joint. So hypertrophic osteoarthropathy can be two types. It can be primary without any cause, secondary is due to some cause. Primary hypertrophic osteoarthropathy, in addition to having those three features, it has one more feature, that is generalized cutaneous thickening. Cutaneous thickening, skin becomes folded, where in face and scalp. That is due to primary hypertrophic osteoarthropathy. Now, the most common cause of secondary hypertrophic osteoarthropathy is paraneoplastic syndrome in lung cancer, that is called as hypertrophic pulmonary osteoarthropathy. Hypertrophic pulmonary osteoarthropathy. What is paraneoplastic syndrome? You have some tumor in the lung and it will secrete some endocrine, in most common in lung cancers, they will secrete, those lung cells, the cancer cells will secrete PTH like peptide, PTH, parathyroid hormone stimulating peptide, okay. So because of that, now there will be hypercalcemia, hypercalcemia, hypercalcemia. So lung is secreting hormone and you are getting hypercalcemia. Instead of parathyroid glands, lung is secreting the hormone, that is known as, so that secretion of hormones, not only PTH, that is a common cause, other hormones can also be secreted, that is known as paraneoplastic syndrome. So the most common cause of secondary hypertrophic osteoarthropathy is lung, that's why that is known as hypertrophic pulmonary osteoarthropathy. However, other pulmonary infections, cystic fibrosis, right to left cardiac shunting, lymphomas, and especially pleural neoplasm also have been associated with hypertrophic pulmonary osteoarthropathy. So the name is given because, see, pulmonary, how many pulmonary cause infections of pulmonary cystic fibrosis, pleural neoplasm. So that also cause. So clubbing and hypertrophic osteoarthropathy are having very important relationships. That's why these have to be discussed in cardinal manifestations of lung diseases. So now, what investigations you will do and treat? You will take some history and physical examination you will do to the patient to identify the underlying etiology. Then further diagnostic workup should be performed depending upon the suspected organ system involved, whether it is lung, whether it is heart, whether it is GI, okay. If pulmonary hypertrophic osteoarthropathy is suspected, then radiographs of the epiphysis of the long bones can be obtained, and CT scan you should do, CT thorax, okay. And one more thing is, you can do bone scintigraphy. This is helpful in excluding the skeletal involvement, bone scintigraphy. Basically, you just do radio x-rays of the epiphysis of the long bones and chest CT, that's all. Now, there is no specific treatment for osteoarthropathy or clubbing. Treatment of the underlying cause itself will resolve the clubbing and osteoarthropathy. That's the main thing. So you treat the cause, these two will go off. So with this, we have concluded the topic of clubbing, okay. Do share your comments below if any improvement is required. So thank you for watching. So we'll meet in the next topic.